Hi, everybody. Welcome to GW Center for Integrative Medicine YouTube channel. I'm your co-host, Dr. Kogan. We have Dr. Jennifer Rioux with us today talking about Ayurveda. She's been with us on this channel before, I think more than once, I think twice.
Yep.
But today we have a very specific angle. So we're going to talk about weight loss program that Ayurveda is really good at. And Jennifer, let's start with just a little bit of basics. What is Ayurveda, just in case somebody who's going to listen to this don't know at all.
Absolutely. And if you don't mind, I'll share my screen because I have some slides that cover even just the basics of Ayurveda. So
Mhm.
let me pull that up and then, so everyone can see my slides now?
Yeah. Mhm.
Okay, perfect. Okay, so I'm going to talk about the basic philosophical and practical treatment applications of Ayurvedic medicine, and then just transition into weight loss in particular, and talk about the outcomes from a pilot study we did using this protocol for weight loss. So I'll just begin by talking about what is Ayurvedic medicine. It's a humoral system of medicine based on the 5 elements, which are air, space, fire, water, and earth. These elements work in pairs to inform 3 bioenergetic systems, which many of you may have heard of. They are Vata, Pitta, and Kapha. They're referred to as the doshas. Overweight and obesity is an imbalance of Kapha dosha, so that is what we treat when we have a protocol for Ayurvedic approach to weight loss. And the constitution is where we begin our understanding of the patient. That is referred to as Prakriti, and it represents the baseline state of health for the individual. Imbalance is referred to as Vikruti, and that is what we're talking about here, is that obesity and overweight are a Kapha imbalance. So let's just really quickly talk about the 8 methods of assessment in Ayurveda. They are pulse, stool examination, urine examination, tongue examination, palpation and percussion, voice and sound examination, examination of the eyes, and the general appearance of the patient. So we use all of those things to get an understanding of the patient's imbalance and how it's expressing in their physiology. And here's a little bit more about the Prakriti Vikruti paradigm, which is just, again, the individual's baseline measure of balance is their Prakriti. That's given to them at the time of conception, according to their parents' genetic material and some other factors. Food of the mother, dietary intake of the mother, the climate that she lives in, the season, relationships that she is exposed to, her psycho-emotional state, and any kind of stress or trauma. And as we go through life, we do things that are imbalancing, so we diverge away from our baseline constitution, and that is what becomes our imbalance. And that can be poor diet, stress, toxins, poor quality relationships, making decisions that are imbalancing, like, we don't get enough sleep, and disharmonious environmental influences. And that can even be things, structural determinants of disease like poverty and, kind of insecurity in one's daily life. So this is just a table of the 20 attributes and how they are associated with the 3 doshas. But the one we're going to focus on here is Kapha, which is comprised of water and earth. And so these are the qualities associated with Kapha. It's cool, heavy, liquid, soft, slow, dense, sticky, oily, slimy, and static. And you'll see as we go through that those are the qualities that we want to pacify in addressing a tendency towards overweight or obesity. So Kapha manifests in the body, mind, and emotions in these ways, according to these qualities. So typically a person with a Kapha constitution, they have a tendency to become overweight or obese, and they already begin with a large frame, heavy bones and muscles. They have a grounded personality, tend to just be more of a slow talker or walker. The metabolism is a little bit sluggish, which is one of the things that can inform overweight or obesity. Likewise, the cool quality means that digestion is not quite as strong as it could be. The liquid quality can sometimes manifest in congestion. And the dense quality is what is responsible for a denser layer of fat than in some of the other constitutions. But they have a lot of wonderful qualities. In the psycho-emotional self, they're really prone towards devotion, love, compassion, kindness, oriented around relationships, things like that. There can be stickiness in the emotions, attachment, and a tendency to collect things. But overall, we can typically motivate a kapha predominant patient by appealing to their understanding of who they are within their relationships. So Agni, or metabolic fire, is a really important concept in Ayurveda. There are multiple types of Agni. I'm just highlighting a couple here. Jatar Agni breaks down food into nutrients and waste, and Bhuta Agni creates the byproducts of the process, which circulate in the blood supply and provide nourishment. One of the primary concepts in Ayurveda, which is centrally important for overweight and obesity treatment, is that toxins will accumulate in the digestive tract if metabolic fire is weak or not optimal, and then they can leak out of the digestive tract and into other tissues in the body, and they can create all kinds of problems, blockages, stasis, dysfunction, and that ultimately leads to disorder, symptoms, and disease. The way that Ayurveda works in terms of a treatment approach is kind of depicted here in this picture, which is that you begin with the original constitution. You understand that as a baseline for the patient, but we're always treating the imbalance. And then we take into consideration all these features of diet and lifestyle, psycho-emotional factors, relationships and social context, and sensory input, and the environment, which includes the natural environment. Now, Ayurvedic treatment for specifically overweight and obesity, we have a dynamic assessment process. So we're going to look at what is the patient's level of activity, or do they have a sedentary lifestyle? What is the quantity of heavy, dense, oily, rich, or processed foods? What's the status of digestive fire? Is that weak? Do they have an original kapha constitution? What about mental energy? Is there sluggishness in the mind? Is there any type of depression or unresolved hurts? What is the climate and what is the season? So it may be easier for a patient to lose weight or maintain their weight in a warmer season or climate. So we can account for that. And then just looking at whether there's stagnant energy in the organs and channels of the body that we can address. So some of the ways that we do that could be through use of herbs and oils, obviously diet and exercise. In this case, we're going to talk about yoga therapy. We're going to focus on detoxifying the digestive tract so that there can be optimal digestion. We're going to look at sleep and daily routine. We're going to make sure that the patient has a really very well-developed sense of self-awareness. This helps with food choices and with activity levels, but also with managing the relationship between emotions and food and relationships and food. And we're also going to look at the level of sensory input, because excess sensory input can also inform toxicity in its own way. So we want to look at that. And also if digestive fire or metabolism is not functioning optimally, we have methods for just kind of rehabilitating metabolism. So I want to talk a little bit about the study that I did on an Ayurvedic medicine and yoga therapy pilot study for overweight and obesity. And I want to talk a little bit about the data collection, because this was a little bit different. And basically, the way that we used it in order to be authentic to the paradigm of Ayurveda, because Ayurveda treats root cause and it's oriented around the individual. So we use standardized intervention guidelines, and that's consistent with the kind of best practices in research. But we maintain tailored treatment features. And so you end up with kind of a hybrid protocol. And so you're both adhering to best practices within the paradigm and within the understanding of research. And the data collection instruments were designed specifically to increase adherence to the protocol. So that's an added benefit of the way that the data collection instruments were designed. This is kind of a basic pictograph of what it looked like for data collection in the study. And what we did was an initial assessment of an hour and a half, and that's typical with standard Ayurvedic practice. And then we intervened in terms of diet and assessed and intervened in terms of diet and daily routine, social environment, and context. We looked at the patient's constitution and imbalance profile, which informed the intervention strategy. But the intervention strategy overall was going to be to pacify that kapha dosha and detoxify this system while rejuvenating metabolic fire. And then we met with the patient twice a month to just see where they were, make any adjustments that needed to be made, and to make sure that data collection was on track. The patient self-report measures were 6 specific areas of change and also some measures of self-awareness. And overall, we were redirecting the patient's imbalance back towards their constitutional baseline, which was their barometer of health. So in this pilot study, we had mean weight loss post-intervention, which was 12 weeks. And then we had a 3-month follow-up and a 6-month follow-up. And at post-intervention, the mean weight loss was 8 pounds. At 3 months, it was 10.2 pounds. And at 6 months, it was 13 pounds. So anybody that knows anything about a weight loss protocol knows this is pretty good because we didn't provide any continuing support to the patient after the 12-week intervention. It was just that they were able, based on an understanding of their own constitution and balance and their habits, to establish really durable parameters for change, and to do it in a way where there wasn't a lot of calorie counting. Well, there's no calorie counting. We're looking at foods in terms of qualities, and you'll see that later. But there weren't some of the traditional mechanisms of dieting, which feel very much judgmental and which have a lot of stigma attached to them. The patient was just asked to increase their awareness around the types of food qualities that they were ingesting and to follow basic guidelines about what to include and what to avoid. So the mean percent weight loss was almost 4% at the end of the 12 weeks, almost 5% at 3 months, and 6% at 6 months. So again, this is very good because a clinically meaningful weight loss is around that 3, 4, 5% mark. And so you will get then regression in actual disease states that are associated with overweight and obesity. So this is a very positive result.
And it's
Changes
very
in
unusual
yeah,
result, right? Because
yes.
usually after you end intervention, there's always a little bit of a reversal of the weight loss. There's always regaining of partial regaining of the weight. And almost all the studies that ever been looked at that, there's always a little bit gaining back. So the fact that you're continuously seeing patients lose weight is pretty impressive.
Yeah, and I think that's because the Ayurvedic paradigm allows for the patient to reestablish a relationship with self, reconfigure their identity in a certain way, and to understand more positively their relationship for food and what works for them or against them in terms of retention of weight and a high BMI. So I think it's very, very positive. And patients' emotional response or satisfaction measures for the program were also very, very good. They felt that they were sort of seen and heard and recognized in terms of their individual needs, but they also had that collective experience of social support that is really often very important in weight loss programs.
Mhm.
So the BMI measures, which again I think are BMI is not the best measure. We do have some other better measures, but it's still useful to look at. So the average BMI at baseline was 33.2, and that went down at post-intervention to 31.9, at 3 months, 31.2, and 6 months, 31 well, you can see it leveled. 3 months to 6 months, it maintained the same. So that is, and these were people who were significantly overweight or obese. And that's also an important thing to mention because sometimes people will say, oh, well, obese people can't do yoga, or, these kinds of interventions that are more nature-based or more holistic in their orientation don't work for very obese patients. They only work for people who are, less overweight. And I think this demonstrates that that's not the case. We were able to support everyone through the yoga portion of the intervention with basic modifications and props. And these were all yoga naive people. There was nobody in this group that had previously done yoga, which is also an important feature of the design, because then you can't say, oh, well, they adapted to yoga because they were familiar. In fact, none of them had previously done yoga. So I think that's something important to
How many,
mention.
how many people were in the study?
So this particular study was very small. It was very diverse in terms of the racial and ethnic representation. We had, I think it was 15 patients, but we had, I think, 20% Native American, 30% Hispanic, 30% white, and 20% African American within that small group. So even though the group was small, I think representation-wise, we had a diverse group. And what was interesting about that is that the nature-based protocol of Ayurvedic medicine, everybody could tap into it in a different way, and we were able to adjust the dietary guidelines for all kinds of different ethnic nutritional guidelines. Like if somebody said, well, I eat particularly a Hispanic diet at home because my family, this study was done in Arizona. So my family is originally from Mexico. We were able to work with that because this is based on food qualities. It's not based on particular recipes. It's not based on telling a patient exactly what to eat and not eat, but to really look at food qualities. And you'll see that as we move forward in some of the other data that we have.
Mhm.
So one of the important things about this was establishing a tipping point for where continued weight loss and maintenance of weight loss was established. And so we were able to do that through statistical analysis, demonstrate that individuals who lost 3% or more of their baseline body weight continued to lose weight. And we were able to look at what that meant in terms of adherence. So in order to lose 3% or more of their baseline body weight, patients needed to adhere to 62% of the dietary advice. And that's not, it's not 80%, it's not 90%. I mean, it's just over half of the dietary advice that we gave them. So that provides a lot of leeway and flexibility for patients to overcome challenges with dietary advice, to try to find how they can feed themselves within sort of the preferences of their family within the dietary guidelines. So I think that is conducive to making a wide variety of people, making it possible for them to lose weight with only 62% as the adherence that was required for that. Now, in terms of yoga, those who lost 3% or more of their baseline body weight adhered to 75% of yoga classes in home practice. So that's a little bit higher, but I think we all know that movement and exercise is a very important part of weight loss. Diet alone typically doesn't do the trick, but we can look at some of the rest of the tables to break that down a little bit more. So here you can see the blue columns are 58% dietary adherence, and they're at 3 months, post-intervention, post-12-week intervention, 3 months and 6 months. So at 58%, patients lost a mean of 11.25, at 3 months post, 15.4, and at 6 months post, 19. So that's impressive, but then if you look at yoga adherence and weight loss, and this is at 55% or more, you get even a little bit better result, 11.8 pounds at 12-week post-intervention, 16 at 3 months, and 20 and a half at 6 months. And if you look at diet and yoga adherence together, 55% plus, you see a really pretty impressive measure, 13.7% at 12 weeks, 19.3 at 3 months, and almost 25 pounds at the 6-month mark. So you don't see this very often, honestly.
Yeah, that's very impressive. I mean, I have, to cross 20-pound mark consistently. I mean, it's probably less than 10% of all the studies ever conducted on the weight loss have ever reached something like this.
Right, and this is very low tech. It's non-invasive. It's low cost for the most part. You think about meal delivery programs and things that can get very, very expensive.
Very
So
restrictive. I mean, this is
and
a
very restrictive. Yeah,
non-restrictive program.
right. So this is, I believe, percent weight loss, exactly. So at 58% diet adherence, we saw 5.2% post-intervention, 8.4% at 3 months, and 8.9%, so 9% at the 6-month mark. With the yoga adherence at 55 plus, 5.4% post-intervention, 8.5 at 3 months, and almost 9.5 at 6 months. And with combined yoga and diet at 55% plus adherence, 6.4% at the post-intervention mark of 12 weeks, 10.5 at 3 months, and almost 12 at the 6-month mark. So this is BMI change. And again, here it's broken down by dietary adherence, yoga adherence, and combined. So, but let's just look at the combined. The mean BMI at baseline was 35.1, and that went down to 32.9 at post-intervention, 31.6 at 3 months, and 31 at 6 months. So continued changes in reduced BMI throughout. Now, these are some charts that I wanted to share because I think it shows how the holistic nature of the program really supported people to understand their own habits. So we looked a lot at self-efficacy under certain circumstances. And this is looks specifically at dietary self-efficacy in terms of establishing routine and adapting to circumstance. So you can see here 3 months post-intervention is the blue circle, yellow is post, and red is baseline. So under circumstances of TV and computer use, people were really able to maintain their dietary change. That's a big thing for a lot of people. Under work stress, that was also maintained. It fell just a hair at the post 3 month mark. Cooking was very stable. Travel, which is a big thing for people. People often fall off their positive dietary habits during travel, and they were able to maintain that at the 3 month mark. Actually, it kept increasing at the 3 month mark, which is great to see. And in terms of shopping, and that can be, I think the focus here was food shopping. But again, it was the changes to dietary habit were maintained. Here we have dietary change and self-efficacy in terms of internal emotional regulation. A lot of people have emotionally motivated eating habits. So we wanted to look at how does self-efficacy play out over time. So one of the ones that actually was interestingly did not maintain efficacy was boredom. And so they did great during the intervention. You can see the yellow circle. So they really improved their dietary self-efficacy when bored during the intervention, but that fell rather precipitously. So that's an area when people can benefit from additional social support. And then when alone, that kept going up, even post-intervention. So that's very positive. Relaxation was another one where they seemed to lose some ground post-intervention when support wasn't being provided. So that's something that could be part of a support group or network that could continue after the intervention. Depression was one that kept going up. Being in a rush or in a hurry was another one that kept going up. And cravings for sweet and salty, which are part of the kapha pacifying Ayurvedic dietary program, were something that started to slip a little. So the next one is exercise self-efficacy. So again, this was adapting to circumstance around exercise. So you can see that there were big improvements in terms of, while I'm traveling, can I maintain my exercise routine when traveling? The post-inactivity, this is a really tough one for people who are trying to lose weight. When they have a period of inactivity, they tend to really regress. So you can see here that's common and also demonstrated with this program. We need to provide additional social support post the intervention so that people can maintain. But you can see where the yellow circle is. They really did great during the program in terms of re-engaging with their exercise and movement program even during after a phase of inactivity. Work and school stress, which was another one that was a little bit challenging for people. But again, here you see TV and computer use continued to go up in terms of self-efficacy. Now, these next few slides are really about best responders. And so this is the way that we ask people to map their dietary intake. We ask them to use various methods of self-awareness that we train them in to experience the qualities of their food in terms of an Ayurvedic paradigm. So I'm not asking you to cook something particular. I'm not asking you to count calories. I'm really just asking you to let me know, are you eating heavy, dense, sweet, processed, creamy, oily, cold, light, dry, bitter taste, crunchy, raw, leftovers, spicy, etc. So there was a food wheel that patients completed weekly, and we're able to see what some of the patterns are here. This person lost an amazing 15% almost of their body weight, if you can
Wow.
believe that. Yeah, very incredible. And but what they really did, you can see the post here is the their dietary habits after the intervention, and the pre is the blue. So they ate a lot more raw foods, they ate a lot more fresh foods, they ate a lot more warm foods, they ate a lot less salty foods and less sweet foods. And those were the primary things that really led to a major change for them. And they didn't have the stigma or the kind of negative self-judgment in approaching their diet this way that comes with a lot of dietary programs. They were just kind of using their self-awareness. And we had asked them to minimize certain qualities and maximize certain other qualities, and they were able to do that.
And this is without any caloric restriction, pretty much. This is really important point because, most of the diets will engage some kind of caloric restrictions. You're going to hear from quote unquote experts saying, oh, you got to minimize, you basically have to cut the calories down. It just doesn't work. We know if you cut the calories for a particular period of time, it's not forever. Eventually you're going to stop doing that and you're going to regain everything. So this is really important point. Here, there was never a restriction in caloric intake. You're simply changing the content of the food and you're following completely, utterly different principle. I just want to highlight that.
Yeah. And I think it gave them a way to engage their mind. And this also, the way that the data collection was oriented was that as they tracked their food qualities that they were eating, they were filling out a colored template. And so they could see by the way the color shifted around the template, what they were doing and what they were emphasizing and what they were minimizing. And in that way, their dietary change habits were reinforced just by the kind of shifting colors in the picture. So it was really, non confronting in terms of identity, and also very, I think, engaging in a way that it requested that they really maximize their self-awareness around food. So this is a second best responder. So this person lost 7.5% of body weight. And so you can see here, it's a very different pattern. And that's kind of what I want to emphasize, that it's not just one thing. So the first person, minimized certain qualities and maximized others, and it worked very well for them. This person did something different, but it worked almost equally as well for them. So in this particular person's case, they really ate a lot more raw. They ate, interestingly, a little bit more cold food, more light food, but they really, really reduced their leftover foods. Leftover foods are not considered to have great metabolic fire within them. According to the Ayurvedic theory, we get our own metabolic fire is fed by the metabolic fire in our foods. And so if we eat a lot of leftovers or food that has compromised metabolic fire, like things that are, dried and dehydrated and reconstituted, like bars and things like that, it's really hard for the body to utilize that in a meaningful way. So we get the calories without so much the nutritional content that we want. This person also, you can see how vastly they reduced their intake of the sweet taste, and how, what was the other thing I wanted to mention?
Well, they did
Leftovers,
also look
sweetness.
like they also dramatically reduced processed foods.
Yes, yes.
They basically reduced them almost.
Exactly. The processed food was. And so between the thing about the standard American diet, right, which is referred to as SAD, is we have so much processed food, and it is really nutrient poor and sometimes calorie dense. And it is very difficult for the body to recognize because it's so far from its original form. So when we're able to reduce that processed food intake, the body can begin again to rehabilitate metabolic fire, to begin to use calories in a more efficient way, and to begin to also have different types of cravings and avoidances. Oftentimes when our metabolic fire is compromised, then our sort of attraction to certain foods becomes disrupted. And we can see in the science that processed food is actually engineered to create more and more cravings for additional processed food. And so when we're able to reduce this processed food, we can see the result, not just in weight loss, but overall, I think, quality of life and better choices. And this is just the third person we'll look at. So this person lost 5.2% of their body weight. And you can see that the chart looks so profoundly different, but it was still very effective for them. They really, really increased their warm food, which is important for provoking digestive fire. In Ayurveda, we want to warm the digestive tract. If we eat a lot of cold food, it doesn't really impart the warm quality into the GI tract in the way we need to metabolize well. They increased their intake of light quality and raw quality, and they reduced their intake of the sweet taste, and it looks like
Process, not the process.
also the processed, right? So, and we did give general guidelines to patients, please avoid dairy, please avoid processed food, please avoid leftovers after 36 hours. We encourage them to eat more raw foods, more light foods, to eat less heavy and dense. So we gave them these basic kind of guidelines, and for them to be able to follow them in a very, flexible way led to, I think, the kind of success that we see here. And I wanted to just mention some secondary outcomes that are important in Ayurveda, but and not often considered in other systems of medicine. Hydration is very important for proper nutrient uptake, metabolism, and even elimination. And in Ayurveda, the number of bowel movements we have per day, or the amount we are able to eliminate, is important because we want to see a relatively balanced relationship between input and output. So if we're intaking 3 meals a day, but we're just maybe not eliminating even once a day, it's going to create a lot of backlog in the GI tract, which is going to inhibit nutrient absorption and also create craving for certain foods or avoidance of certain foods, and it reduces energy, it can reduce motivation, it can increase disordered mood. And so that kind of stagnation in the GI tract has a lot of negative effects in the body. So we looked at bowel movements per day, which started at 1.3. Post-intervention, they were up to 2, which is a really good improvement. At 3 months, 1.8, and then they were decreasing a little bit more post 6 months to 1.5. We looked at appetite. Now, appetite was 75 on a scale of 0 to 100 baseline. It decreased to 69 at post, back up to 73 at 3 months, and back up to 75. So you can see it returned to its pre-intervention status. And so that's another thing we would provide additional support for. And the
But
water was measured.
that despite that, there was no loss of the gain loss, so to speak, right?
Right,
So,
right.
so even though some of these parameters were shifting backwards, but you're still seeing continuous weight loss. So it's probably it's reflective of the macro shift that
Yes. Yes. And I think it would be great to follow people for even up to a year to see, well,
occurred.
what happens between 6 and 12 months? Let's see what else occurs. So you can just look at typically in integrative medicine, we might say, oh, we'll drink 8-ounce glasses of water a day. We might have that as a benchmark. And you can see that people were at 42 when they began post-intervention. They were at almost 63 ounces. And 52 post and 52 at 6 months. So that is, a net increase of 10 ounces, even at that 6 month mark. So that's a really good basic self-care measure that improved. And then their measures in well-being were
Let me pause you here for a second because I think this is
Yeah.
important. So I don't remember when I'm looking at lots of different weight loss studies that this is measured. This is
Not
not
usually.
common, right? I
Mm-mm.
wonder why. You would think it's such a self-explanatory thing to do. I mean,
Western biomedicine doesn't think about hydration as a key factor of health in the way that a lot of the, integrative, holistic, and world medicines
well, I
do.
mean, you hear, especially for older adults, you hear this push for better hydration all the time. But interesting, why it's not sort of a standard of care within the bariatric medicine. Bariatric is the word for losing weight, and I just find that I mean, I mean, it's pretty obvious. At the very least, you would assume that when you take in extra fluids, it increases the stomach volume, so suppress appetite. At least on a superficial level. You're talking about much deeper energetic supposed to.
Right. Well, what's important, I think, to recognize is that you need the fluids to help process the foods, right? To help break them down, to help absorb the nutrients, to help metabolize, and even for elimination. I
Mhm.
mean, constipation and poor elimination is often, a key component of that is dehydration or insufficient fluids in the body. And so, it really has an overall type of negative effect when we're underhydrated, and is certainly relevant, I think, for weight loss. But on the well-being and quality of life measures, I love these numbers because we didn't have 66 on a 0 to 100 scale is not terrible for well-being, but we would certainly like to see more. And that increased almost 13 points post-intervention. That stayed at 3 months, and it didn't even fall that much at the 6 month mark. So we had a full, basically 7% gain that was maintained, or 7 point gain that was maintained at post 6 months. So that's great. And the quality of life measure also bounced up about 7 points and even improved at 3 months post intervention, but there was a drop in that at 6 months. And energy also
So why
increased.
why is that? Because that's the only parameter that got worse after the end of the trial. You see this? It's,
Well, it was kind of similar to baseline. I mean, I think with something like this, with a small sample size, you could say, well, maybe there was somebody who had a negative life event, and their numbers could, have a big impact on just this one measure.
Mhm.
So I think it's harder to account for that. But it was
It's
still up a
also,
little
it's
at
also
6 months.
very
So
small. It's also very small.
quality of life varies a lot, day to day for pretty much everyone. So it's a snapshot in time when we ask somebody for that kind of self-report measure.
Mhm.
But we saw that energy also improved about 6 points, 7 points post intervention. That continued to go back to baseline at post 3 months, and that one did fall below baseline. So I think that's another one in which we can provide additional social support. And if people stopped doing their yoga practice, provides so much vitality to the body that could also be
Mhm.
a factor here. So I think the last thing I wanted to say about this is just that there are some publications out here to support this. And so this is an evidence-based program, and it's in the peer-reviewed medical literature. And we want to do an expansion of the program to encompass more people and repeat the measures and perhaps follow people for a longer period of time. So patients that want to engage with this program, you can choose to participate in the data collection or not. That's not compulsory, but you can at least look at some of these publications and see for yourself what exists in the literature related to this program. So there's this one, and there's this one that is specifically on this intervention. So I think that's all I
That's
have to
great. So
share
let me
about the
ask you,
program.
yeah, let me ask you a couple of questions that are more of a general. You can unshare your screen. So, so let's say somebody would look at this and say, "Look, I need to lose weight. I want to come and see you, and I want to work with you." But I've tried like 10 different programs before, and I failed everything. So why would I join your program when I failed everything else before? So what would you tell to the person like this?
Yeah, and I didn't include any of the qualitative data from this program today, but we did ask people, to give us a more narrative kind of understanding of why the program worked for them. And there were a lot of people in the program who'd been struggling with weight loss their entire life. They had done a lot of yo-yo dieting. They had lost, they had regained, in some cases more. They tried again, and nothing would stick. And what they conveyed to us was this was a comprehensive behavior change program it was accessible for me. I could integrate it into my life. It wasn't so restrictive that I felt I was being denied. It wasn't so restrictive that I couldn't eat with my family or my spouse or my partner. And we had people who were making changes in the household overall, from one of them being in the program. Other people's dietary habits changed in a positive way, and they were also losing some weight. And so I think they just conveyed to us that it was an accessible and durable behavior change program that, yes, it was about eating differently, and yes, it was about increasing physical activity and exercise, but it was non-judgmental. It wasn't around calorie counting. There was no stigma associated with it. It had these features of increased self-awareness and self-reflection that were really important. It encouraged people to understand their own self-efficacy around diet and exercise. When do I have trouble managing my diet? Is it when I'm on the computer, or is it actually when I'm upset about something? Is it when I'm in a hurry that I make bad food choices? So there were a lot of aspects of self-reflection and mindfulness that I think just helped them to have a better sense of self-understanding. And they just said they integrated it in a durable way.
And so let's talk a little bit about pragmatics here. So you mentioned halfway through that the patient's meeting with you every 2 weeks. So it's 6 visits for 12 weeks. How are you integrating yoga visits and like teaching of the movement? Is that integrated
Right.
those every other week, or how does this thing?
Yeah, so in this case, we would meet twice a week for yoga, and I think we could do that online. If we have space, we can do it in person. But basically, with the yoga, it was a graduated protocol. So begin slowly to learn basic movements. It was basically the same sequence each time, but we would add as we went through additional poses. And so the sequence would become a little more robust or vigorous over time. And patients were able to adjust according to their fitness level in a way that was manageable for them. And because the sequence itself was repetitive, they weren't doing something different every time. They were able to get to a certain point of memorization. They were doing the exact same sequence at home for home practice. So it became a very routine thing for them. And and there were self-awareness and meditative aspects there that also fed them kind of at a mind-body level. So and then when we would meet twice a month to go over changes to dietary habits, we would talk about, so how is this working in terms of your relationships with yourself, with other people who are important to you, in terms of what's going on in your environment with work stress or school stress, because this was done at an academic medicine center. So I think it was just that patients felt really supported. 2 weeks was enough where they didn't feel like they were being micromanaged, but they had sufficient support. And the yoga practice, in terms of the instructional component, was frequent enough for them to really be able to maintain and to implement a home practice.
This is great. So I will make sure that when this video gets posted on our YouTube channel, that all the links are in there. So we'll have links for both of the articles you showed us. We'll have a link, of course, to your bio as well, to our website. We are creating special page on our website that will link to exactly this program, so people can sort of come back and read a little bit more. And of course, we will also link this video over to the website, as well as just keep it on YouTube. So Jennifer,
Great.
thank you so much. So again, everybody, this is Dr. Rioux, who is our Ayurvedic practitioner, Ayurvedic doctor at the clinic. And we were talking about Ayurvedic program for weight loss. And if you're interested, give us a call, 202-833-5055, or find us on internet at gwcim.com.
And
Thank you.
Dr. Kogan, I just want to mention, so visits can happen through telehealth. So anybody can do this anywhere across the country, or frankly, they could phone in from elsewhere in the world if that was, if somebody from the UK or somewhere else was interested. So
Great. This is important. Thank you so much for mentioning that. So don't forget to subscribe if you find this information helpful. We'll see you back talking about health, disease, and health prevention. And stay tuned and stay safe. Thank you, everybody.
thank you. Bye-bye.